This screencast has been devised specifically for those AAS students that are studying the OCR specification for physical education. The focus of this screencast is to look at the heart's conduction system and the processes involved in causing the heart to contract. The heart's conduction system is a question that's frequently asked, and this is an example from a past paper of how the question might be worded. Simply, it says describe how the heart's conduction system controls the contraction and relaxation phases of the cardiac cycle. So, as you can see, this question is worth 5 marks, and hopefully by the end of the screencast it would be the type of question that you would be able to tackle and be able to answer fully. So before we jump into the exact stages of the conduction system, it's important to highlight what the cardiac cycle actually is. And simply, the cardiac cycle are the events of one heartbeat, which will involve the contraction and relaxation phase of the heart. And you should remember from your course that this entails the diastole phase, which is the relaxation phase, and the systole phase, which is the contraction phase. The heart is a very unique organ in that it is able to generate its own electrical impulse, which is known as the cardiac impulse, and this cardiac impulse is what is responsible for causing the heart to contract and relax. This electrical impulse that's responsible for stimulating the heart is actually generated by the heart itself, and because of this the heart is said to be myogenic. Using the diagram shown, which is taken directly from your textbook, we'll be able to go through each stage of the conduction system and explain it in depth. And hopefully with the diagram, plus the information that will be provided on the left hand side, this should give you a better understanding of what actually happens and how this cardiac impulse stimulates the heart to contract and relax. So the first stage of the conduction system involves this cardiac impulse, this electrical impulse that we've been talking about, which is initiated from a node which is called the sinoatrial node, which you can see right here on the diagram marked at number 1. And this SA node is located in the posterior wall of the right atrium. So remember, in any heart diagram, this would be the right hand side. Because the SA node is responsible for initiating this cardiac impulse, it's also known as the pacemaker. So that's another word for it, but if you're answering it in an exam, always refer to it as the SA node, but it is also known as the pacemaker. The second point you must make when talking about the conduction system is that the cardiac impulse that is initiated from the SA node then travels from the SA node through the left and right atrial walls, which causes both of these atria to contract. And as you should know, this is known as atrial systole, where both atria will contract as a result of this impulse. And although it is difficult to see in this diagram, there are faint red lines here that show from the SA node that spread to the left atrial wall and to the right atrial wall to represent this impulse causing the atria to contract. As this impulse spreads to both the left and right atria, the ventricles below are actually insulated from the atria, and these will not be stimulated at this point, as they can only be stimulated by the electrical impulse that's sent from a new node, which is known as the AV node, which we'll go on to talk about now. After the cardiac impulse caused from the SA node has made both atria contract, the impulse will then reach and activate a new node, which you need to know, which is called the atrioventricular node, or AV node for short, which is also located in the right atrium. And this impulse from the AV node will pass down specialized cardiac muscle fibers, which are known as the bundle of His, shown here. And the bundle of His is located in the septum of the heart, which is basically the heart muscle of the wall, which splits down the middle of the ventricles. So that's all you need to know at this stage, that the impulse from the AV node is passed down the bundle of His, which is located in the septum of the heart. It's important that as much blood as possible is passed from the left and right atria into the ventricles, so that there's more blood that then can be pumped to the lungs and the body. So because of this, the heart can allow this to happen by the AV node actually delaying the impulse slightly to allow the atria to finish its contraction phase, to get as much blood as possible down into the ventricles before they contract from the impulse sent from the AV node. The final stage of the conduction system involves the cardiac impulse that has now spread down the bundle of His, then splits off into both the left and right branches of the bundle of His, which is shown here on the diagram. And this impulse spreads down to the bottom of the heart and up around to the left and right ventricle walls through a network of Purkinje fibers, which is a new word you need to be familiar with. And this impulse, which is spread up through the Purkinje fibers, then causes the both ventricles to contract. Once these ventricles contract and empty the blood from both the left and right ventricle, they will then relax, which they will go through ventricular diastole, and then this cycle is then repeated with the next cardiac impulse again being initiated from the pacemaker or the SA node. And all of those stages that we just went through is what happens obviously much quicker, as it represents just one heartbeat or one cardiac cycle. Finally, we can use this video that I'm about to show you to try and talk through exactly all of the stages, just to recap what happens. So initially, the cardiac impulse will be initiated from the SA node, which is here and should be highlighted on the video. And as you can see, the impulse is very, very fast, which is very evident in this video. As you know, the SA node is also referred to as the pacemaker. The information below you don't really need to know about too much at all about the thyroid hormone or epinephrine, but all you need to know is that the cardiac impulse is initiated from the SA node, which is causes the atria to contract, and then this impulse spreads to the AV node. And as you are aware, this AV node is responsible for sending the impulse down those specialized muscle fibers, cardiac muscle fibers known as the bundle of His, located in the septum here. And these are both the left and right bundle branches where the impulse is now reached. Towards the bottom of the heart, there's Purkinje fibers, which is spelled a little bit differently. It must be the American spelling, but don't worry too much about it. And these are the fibers that allow the left and right ventricles to then contract. And as you can see, this is the diagram showing it in its entirety of the impulse being spread from the SA node to the atria, from the AV node down to the ventricles. And this is the process of one heartbeat or one cardiac cycle. And finally, just to finish the screencast, if we remember back to the example question that was given at the start, that involved describing how the conduction system of the heart controls the cardiac cycle, it's very useful to access and use the mark schemes that are provided by OCR on their website. So this is the mark scheme that was taken directly from OCR, and it highlights where you can actually get your marks. So the first couple of marks that they've said, well, they talk about the both diastole phases where blood will be filling both in the atria and the ventricles. So we know that the relaxation phase is diastole. So the first point they've given is atrial diastole is when the atria will fill with blood during atrial diastole or the relaxation phase. Ventricular diastole is when blood will passively move into the ventricles during ventricular diastole. Now, if we look at point 3, this is where we're really getting into the stages of the conduction system and how it controls the cardiac cycle. So the first point is the sinoatrial node initiates or sends an impulse. Okay, that was the first stage, and what we looked at, that the impulse was initiated from the SA node. Point 4, which is atrial systole, and we know that atrial systole is the contraction phase of the atria. The impulse will spread across the atria from the SA node, causing atrial systole or contraction of both atria. So they give you the mark for saying atrial systole or for the contraction of both atria, either or. But in terms of trying to get the correct terminology, using atrial systole shows a better understanding of both phases of the cardiac cycle. The fifth point they've made here is that this causes the remaining blood in the atria to be pushed actively into the ventricles. Then point 6, the impulse that was initiated at the SA node is then reaches the atrioventricular or the AV node, which they would give you a mark for. This impulse from the AV node is then distributed or continues down the bundle of His, which we've looked at. And the last 2 points is that this impulse will then be distributed throughout to the Purkinje fibers. And finally, as we know, because this causes the ventricles to contract, this is also known as ventricular systole. And then the cycle will repeat. So that's essentially exactly what they're looking for that question. With the points that we've went through in the screencast, you would be able to gain 5 marks. So just use this information and other mark schemes for different questions when you're revising over certain points and certain topics.